My name's Emily. I'm a PA student. I'll be working with you today. How are you?
Good.
Good? All right, I'm going to write some things down and then we'll get started, okay? I have a blank sheet of paper. Okay, all right, so what brings you in today?
A rash.
A rash? Can you tell me more about that?
On my arm.
On your arm? Okay. When did the rash start?
About a week ago.
About a week ago. And I know you said it's on your arm. Is it on both arms?
The right one.
Just your right? And can you tell me, is it on the whole arm or just in one specific area?
It's in the elbow.
On your elbow? And since the rash started a week ago, has it been every day you've had the rash?
It's been every day.
Every day? Can you explain the rash to me? Can you describe it?
It itches and burns.
And are you having any associated symptoms with the rash? No. Does anything make the rash better?
Lotion?
Lotion? Do you know what kind of lotion you've been using?
No.
Okay. Does anything make the rash worse?
When I sit in grass.
Being in the grass? And has the rash radiated or has it just stayed in one place?
Just stayed in one place.
Just stayed in that one place. And has it been pretty constant? Does it come and go?
It stays.
Stays. And on a scale of 0 to 10, 0 being not bothersome, 10 being the worst rash you've ever had, can you rate your rash for me?
6.5.
6.5. And have you ever experienced this kind of rash before?
No.
No. Okay, now I'm going to ask you some general questions. You can answer yes or no to these. Have you had any fever?
No.
No. Any chills?
No.
Any fatigue?
No.
Any general discomfort?
No.
Any general weakness?
No.
And any appetite or weight changes?
No.
All right, now I'm going to ask you some questions pertaining to your skin. Have you noticed any abnormal texture? Does it feel different?
It's rough.
It's rough. And have you had any bruising?
No.
No. Have you noticed any new or changing moles?
No.
No. Have you had any pigmentation changes?
No.
No. And have you had any itching?
Yes.
Yes. And have you experienced a rash?
Yes.
Okay, now I'm going to ask you some questions about your hair and your nails. Have you noticed any hair texture changes?
No.
No. Any growth changes?
No.
No. Have you noticed any hair loss?
No.
And any changes in your nails? No. Okay, now I'm going to ask you some questions. You can also answer yes or no to these. Have you experienced any increased feelings of hunger, any increased appetite?
No.
No. Have you had any increased feelings of thirst?
No.
And have you had any increased urination or frequency of urination?
No.
No. And have you experienced any heat or cold intolerances? Are you more sensitive to heat and cold lately?
No.
No. All right, now I'm going to ask you some questions about your past medical history. Have you ever been in the hospital?
Yes.
For what?
My friend ankle.
Sprained ankle. Do you know how long you stayed in the hospital?
Like an hour.
An hour. Did you go to the emergency room?
No.
No. Where'd you go?
To urgent care.
To an urgent care? Okay. Do you remember when that happened? What year?
About like 3 years ago.
3 years ago? So 2017-ish?
Yeah.
Okay. Have you ever had surgery?
No.
No. Are you up to date on all your childhood shots?
Yes.
Did you get a flu shot recently?
Yes.
Do you remember what year you got it in?
Yes. 2019.
2019. And do you take any prescribed medication?
Take a melatonin.
You take melatonin? Do you know how often you take melatonin and how many?
I usually take 2
Mm-hmm.
and about every 3 or 2 days.
And do you take any vitamins or other supplements?
No.
Okay. And do you have any food, drug, or environmental allergies? No. Okay, now I'm going to ask you about some conditions. I just want you to answer yes or no if you have been diagnosed with these or if you have any of these conditions, okay? Any high blood pressure?
No.
Any diabetes?
No.
Any high cholesterol?
No.
Any heart disease?
No.
Have you ever had a heart attack?
No.
Have you ever had a stroke?
No.
And have you ever been diagnosed with cancer?
No.
Okay, now I'm going to ask you some family questions. Are your parents living?
Yes.
Can you tell me their ages?
In the 40s.
40s. Do you have any children?
No.
And do you have any siblings?
Yes.
Can you tell me if they are living and what their ages are?
They're all living.
All living?
And one's 6 and one's 15.
Okay, and are they brothers or sisters?
Brothers.
Both brothers? Okay, now I'm going to ask you those same conditions I asked about for you. You can answer yes or no if any of your family members that we just discussed have been diagnosed with these conditions or if they have them, okay?
Okay.
Hypertension?
No.
Diabetes?
No.
Any high cholesterol?
No.
Any heart disease?
No.
Has anyone ever had a heart attack?
No.
Has anyone ever had a stroke?
No.
And has anyone ever been diagnosed with cancer?
No.
Okay, now I'm going to ask you some social history questions. Do you use any tobacco products?
No.
Do you drink alcohol?
No.
Do you use any illicit drugs?
No.
Can you tell me about your diet?
I don't have one.
No diet. Can you tell me about any exercise that you do?
I did cheer.
You cheer. Can you tell me about your living conditions, who you live with?
I live with my mom and my dad.
And are you currently employed? Are you in school?
Yes.
What grade are you in?
I'm going to 6th grade.
6th. And can you tell me about your finances?
My mom and my dad.
Your mom and your dad. And are you sexually active?
No.
No. Okay, so I'm going to just kind of summarize really quickly. Coming in for a rash, it started about a week ago on your right arm, specifically the elbow. It's been pretty constant every day. It itches and it burns. Lotion has made it better and grass makes it worse. And it's about a 6.5 out of 10. You've noticed that your skin has become more rough and you've had some itching. Alrighty. Well, that is it for today. Thank you. I'm just practicing taking a history and I appreciate your time. I'm gonna wash my hands and that's all.